Today, we have a very spicy and exciting guest for you, Dr. Kate Balestrieri. She is a PsyD, a doctor of psychology, licensed in clinical and forensic psychology in California and Illinois as well. She's a certified sex addiction therapist. She is an author. She is a teacher. She has a lot to say about sex aggression and things that will really enlighten you as to issues we've all experienced in relationships. I personally am very excited to hear what she has to say and teach me just in our short session today.
She's certified in sex therapy, sex addiction, eating disorders, trauma, and everything I'd say of interest to me in my recent life. So today the idea is to have her here and wake us up to the reality of issues that most of us have had in a relationship with one person or another. And we'll go through the different types, but we're talking about like really toxic, negative, bad relationships, problems with intimacy, and issues overall with something called eroticized rage, which you'll explain. So you're located here in LA. Do you see people in your office, or what are you doing now during the COVID times?
Yeah, well, thanks for having me on first. During coronavirus, I'm seeing people via Zoom. So everybody's gone remote. It's been interesting.
Nice. Well, we'll let some people ask you questions during this too, so I'll let them know that they can do some questions below as we're going on.
Yeah.
I'd say just to start off, I think we'll get into bad relationships. What would you qualify as a toxic relationship?
Yeah, the way that I define a toxic relationship is that it's really anything that feels self-destructive or other destructive, and one or both people want to stay in it.
And what do you see mainly in terms of like men or women coming to you, or what do you have? Is there any kind of sex predilection to it?
No, I work with men and women pretty equally. I work with a lot of non-binary folks too, but I would say probably it's a self-selecting population because they're coming in to see me for relationship issues usually, but it's pretty equal in terms of the way men and women report having a toxic relationship. But what feels toxic to them can often be different, right? Okay.
And so a lot of what I've learned of recently as I've been kind of reading through them, I had no interest in relationships myself. I've always had like nice ones. And then I had one blow up, and then I thought back, to the past, and I said, you know what, maybe little tiny bits of this, not as bad as this, that was the worst, but like little tiny bits of this have happened to me in the past. And I try to start looking up, what has predisposed me to finding people like that, whether it be narcissists or, things that you would classify in the cluster B personality disorders. And I started to realize that the stuff we read in medical school was actually real. So can you describe to people, like, is this a real thing? What is, because everyone says, oh, she's a narcissist. What is a narcissist or a borderline or histrionic type person? They're all cluster B type personality disorders.
Yeah,
Describe
so there's a lot of questions there. The cluster B personality disorders really are used to describe a set of static personality organizational styles. So what that means is that people have certain characteristics that show up pretty consistently across different contexts. So whether they're at work, with family, and romantic relationships, with friends, the context is pretty irrelevant. And the key feature with any personality disorder is that it's what we call ego-syntonic, meaning that the symptoms of the disorder are something that actually benefit the person who has the condition, in a sense that they don't necessarily feel the immediate impacts of the behaviors that other people around them experience as really uncomfortable, really offensive or complicated to be present with. And so the motivation for treatment is sometimes not always as high as somebody who presents with something other than a personality disorder like anxiety, depression, post-traumatic stress disorder, because those things are ego dystonic, right? Meaning the symptoms are really uncomfortable, so we want to get rid of them.
All right. So do you find treating either couples or patients where there is somebody with a cluster B personality disorder more difficult, like more frustrating as a psychologist trying to go through and actually convince them of things when, I feel like when I start looking for this in people, I mean, it's a personality type and a personality disorder. And you can see it in different people to varying extents. But when you really get into the ones who have a personality disorder, you can't really convince them or show them reality.
Reality as you see it, but reality as they see it looks very different. And I think for me, what's worked really well in working with people who have more of a personality disordered organization is to really help them understand the pain points of their behavior. And when you can help someone tie together the immediate, here's what I'm doing, and it feels great in this moment to me, but in the long term, there are consequences that I don't like, usually you can engender more motivation to examine those behaviors. But people who are more acute in those conditions tend to come to treatment later and when things are pretty serious. And sometimes they're not motivated to make many changes at all. But certainly I've seen people who have a narcissistic personality organization or a borderline organization come to treatment and do very well if they're motivated to make those changes.
Mm-hmm. And what are like some key character traits that you've seen with those things for anybody, let's say that they're in a bad relationship and they just wonder, am I in this?
Well, let's just kind of be clear. People can have a narcissistic or borderline organization and also have very secure functioning relationships. So a diagnosis does not equal toxicity. But oftentimes without skills, tools, treatment, people who have more acute personality clusters of traits or qualify for a full-blown diagnosis will see more difficulty in their relationships, especially with cluster B personality disorders, because really at the core of those relationships is a pretty fragile sense of self. Or at the core of those disorders. And so when someone has a narcissistic organization,
unconsciously, they typically feel really insecure. And so what we think of as a narcissist in the mainstream media really is somebody who is kind of grandiose, thinks they're amazing, only aligns themselves with what they perceive to be the best organizations, the best people, the most powerful, things like that. They can be very charming, very intelligent, very manipulative, and if they don't get their way, meaning if they don't get the ego needs from whatever their context is, they can get very dismissive and then discard people very quickly. Mm-hmm. So that's kind of a narcissistic personality in a nutshell. What's different with somebody who has more of a borderline organization is that their sense of fragile self is that they feel really empty inside and don't really know who they are. And so they tend to kind of go hot and cold really quickly with people. They can idealize them and then devalue them in the drop of a hat, in one conversation and swing back and forth. And the term borderline was actually originated because people with this kind of condition tend to sort of live in between what is reality and unreality. So they live on that border. Right. Mm-hmm. But as we've evolved as a field, psychologists tend to understand all of these conditions as conditions that evolve out of trauma, specifically a borderline personality disorder. It's really considered more of a complex post-traumatic stress disorder that develops after someone has experienced a lot of different kinds of relational traumas throughout their life.
Okay. And do you see that most cases or most patients, couples that come to you, you can help, or are there some that you just tell one of the people to like cut and run because are there those cases?
I would never tell someone what to do with their relationship, but certainly there are couples that come in who I work with, and one partner is really, really motivated to make it work. And usually what I see is that one person says they're really motivated, but their behavior doesn't match the language. And so it takes some time sometimes to ferret out if they're being placating, and then we have that conversation. Or if they really are just afraid of what it means to make changes, and they need a little time to get through their own resistance.
And what contribution, if any, does like codependency have to any of this?
Yeah, I'm so glad you asked about that, because I feel like codependency is another one of those big words that gets thrown around to mean a lot of different things. What do you think it means when you say codependency?
When I say codependency, it's one person really needs positive kind of feedback always from somebody else. And you'd have both people needing that, which is great, or just one person who's kind of stuck on the other.
Yeah, that can be one form of how codependence shows up. But when I think about codependence, the model for it that really is the most helpful to understand is developed by a woman called Pia Mellody. She's got a great book out there called Facing Codependence for anyone who is interested in learning more. And she does a really nice job of breaking codependence down to think about a couple of core constructs in continuums. So we think about things like core values around feeling safe, feeling valued, getting our needs met, the ability to be creative and spontaneous, and then the ability to be in moderation. And so if we don't get all of our needs met as children, then we grow up and we kind of live in these extremes. So codependence can look like people being more dyadically regulated, or as you said, like kind of contingent and needing of a lot of validation from someone or positive hits. But it can also look on the other extreme, like people being more anti-dependent and being more walled off and confusing boundaries for walls. So it can show up in these two very different ways. But I think a lot of the time we think about people, or codependence is like people pleasing, not having boundaries and not being able to say no, and getting involved in relationships where you're treated kind of poorly. Usually if you're partnered with somebody who has an addiction issue or a personality issue. And so it can be a little difficult to understand the nuance between a codependent situation or potentially a love addicted situation. That is kind of where there's more kind of clinging and unwillingness to let go of a partner.
Okay. And I'm very curious about, what we were talking about before, attention seeking, sex addiction. What makes that like a real thing? I mean, in terms of qualifying as somebody who has a sex addiction, or that it's enough of a behavior contribution to your relationship that it's making things difficult?
Yeah, that's a great question, because there's so much controversy about whether or not sex addiction is even a thing. And it doesn't have an official diagnosis in the American Manual of Mental Health Conditions, the DSM, but internationally it's considered a compulsive sexual behavior disorder. And basically, I'll say it like this in a nutshell. There's nothing wrong with being sexual. There's nothing wrong with having a lot of sex, unless it becomes a problem in your life and you have identified it to become a problem in your life. So when I think about helping someone understand if they have a compulsive relationship to sex, it's really about identifying what are the negative consequences that the sexual preoccupation or behavior has had in their lives. And have they tried to stop and been unable? Do they experience a need for either more sexual behavior, or more extreme sexual behavior, or more new sexual behavior in order to feel the same kind of dopaminergic hit, so the feel goods in the brain? And do they experience any kind of withdrawals if they're not sexual? So are they irritable? Are they anxious? Do they start feeling a lot of shame and remorse? They find themselves obsessing about when might be the next opportunity they'll have to be sexual, and going into sort of that ritualistic thinking. And so if someone can answer yes to all of those things, then they might start to think about whether their relationship to sex is compulsive.
Yeah. So you would, it sounds very similar to just other kinds of addiction and how it feeds back overall. And so we're also, you have the most interesting sounding book name ever, which is, it starts with fuck me, fuck you, rage. Wait, how does it go?
It's fuck you, fuck me, sex, money, and anger in relationships in modern society.
And this book, what is it about?
Well, so it's not published yet. Hopefully it'll be done by the end of this year, but it's basically exploring the way people weaponize their sexuality and their relationship to money in order to feel equal or more powerful, in order to exact revenge and get rid of feelings of shame or humiliation that they might feel. So we see this a lot with revenge porn, right? You don't
revenge
like
porn?
Oh yeah. Have you heard of this term?
No.
Okay, we'll come back to that.
I'm a very gentle porn kind of person. I want to hear about this.
No judgments. So the other ways that people will use sex and money to, really kind of lift themselves up is to kind of fuse together their need for control or to push boundaries and feel like they've got some power, control, some taboo. That's a very big accelerant for arousal in the brain. And then obsession is actually a form of rage. And so when we think about it as it applies to sexuality or money, if someone's got a lot of obsession around this, it's usually a type of hypervigilance response, right? And when there's a perception or a reality of scarcity, rage kicks in, and that panic causes us to want more and more and more and to hoard what we feel is unavailable. So that can look like people getting obsessive in their mind about it. It can, when it comes to sex or relationships, it can look like stalking behavior. It can look like checking their social media all the time, kind of best case scenario.
Yeah. So it's not necessarily like in a relationship. It could be somebody just wanting somebody else.
Well, it could be in a relationship, right? It can happen. I see it a lot happening. This is different than sex addiction, but I see it happening a lot when someone has been betrayed and they get into a relationship with someone else and they're sort of obsessively checking to make sure that they're not cheating. And they might accuse them of cheating, or they might feel really dysregulated in that way. So that obsession or the need to control where they go and who they see and who they talk to is really an exacerbation of feeling panic that they might not be chosen.
Mm-hmm. And so the person accusing you of cheating is not always the one cheating?
Sometimes it is. Sometimes it's a projection, for sure.
And that's another interesting thing. So I've had personal experience with projection. With a lot of it, it's very frustrating. So, what is projection for? I'm very well aware of it now. So, what is projection for everybody who maybe has felt this? I mean, I have my own. The first time I experienced projection was when I was on my psychiatry rotation, and my professor told me, "Did you see how the person got upset and you started to feel like your heart rate went up, or you started to feel anxious? It's projection. It's you actually feel their physical." Manifestation of their emotion. But I started to learn projection otherwise is people can project onto you their own desires, thoughts, and kind of what they're up to. So can you give us like a nice detailed explanation of this?
Yeah. Well, first, what you just described, you feeling on your psychiatry rotation, that's actually projective identification. So that's like the second step, and I'll come back to that in a second. But what happens with projection, and first of all, this is our most primitive defense mechanism. So every human on the planet, as they're growing and developing, projects first and foremost. That's how we learn to stay safe. So what happens is we experience an emotion that doesn't feel comfortable. And because our brains are so newly developing, they're pretty unsophisticated. So our brain, instead of, for example, like using humor or, diving into a new project at work, our brain goes, "Oh my God, this feels gross. Hot potato, get it out." Right? Yeah. And so we just kind of we project this uncomfortable thought that we have or feeling that we have onto whomever is around us. Now, if they have a predisposition or a valence because of their upbringing, their biological temperament, or something like that, to resonate with whatever we're projecting at them, then it will land, right? And they'll start feeling whatever it is they're being pulled to feel, right? So that's different than, for example, if you're experiencing a physical threat, anybody's heart would race, or they would have a different physiological response. But projection, let me think about a good example. Well, I hear this a lot in the couples that I work with. This is such a frequent complaint. One partner will say, "Hey, can you load the dishwasher this way because I like it the way it cleans the dishes when you do it this way." And the other partner will go, "Fuck you. Why are you always going to tell me that I'm wrong or that I'm bad? I can't do anything right." So that's a projection because that person feels like they're not good enough. And it's really uncomfortable to think that they might think that way of themselves. So unconsciously, their brain goes, they think it about you.
Right.
So they project it onto that other person so that their brain can hear it in a different way.
Okay, and you can see kind of an explosive response when that kind of stuff happens.
Yeah.
And then how do these like behavior patterns tie into let's say in a bad relationship, because
Mhm.
I don't want to overuse I'm not sure still what toxic fully means, but like, let's say in a bad relationship, somebody that should get out of this relationship, how does it tie into that person getting stuck? What are the reinforcing kind of behaviors that are going on that cause that to happen, or for it to happen to the same person in 2-3 different relationships?
Great question. So what can happen is, however we grow up, between 0 to 18 months, sometimes it can extend to about 36 months, but really in the first 18 months of our lives, our nervous system is a giant sponge. We don't have any cognitive faculties really developed yet.
Mhm.
So everything that we experience stores memories in our body. And so that's the way that our brain remembers things, based on how we felt by different reactions and things environmentally going on around us. And so as we get older, our nervous system remains primed to respond in certain ways. If there were big enough, consistent kinds of reactions that evoked fear, shame, feelings of helplessness, then unconsciously we tend to encode that with love. Right? And when we get older, our nervous system seeks out partners unconsciously who replicate that familiarity. Even though we might not consciously want anything that is uncomfortable, our nervous system says, oh, this is what love feels like, because we all feel love for our parents, even if in some way, shape, or form they weren't able to attune to us in a way that we needed. And so we had fear or a bigger physiological response. So when people grow up with a lot of chaos, or they grow up where one of their parents had an addiction issue or any kind of mental health issue, or maybe they were experiencing poverty or some other kind of environmental stressor that diminished their parents' ability to really attend to them in a way that was meaningful, they can tend to find themselves in relationships with partners who do similar kinds of things with them. So it can show up in varying degrees. And if someone doesn't practice a lot of self-care and isn't really actively, focused on their own stuff, they can find themselves ass over elbows in a toxic relationship pretty quickly, because our nervous systems find each other, right? And we tend to pick partners who can help us work through unresolved stuff because it feels familiar.
Okay. And is there, for you trying to help somebody through a relationship, that do you ever get to the point where you think it won't work, and it could either be because there's physical abuse, there's emotional abuse, there are things where one person is clearly just suffering from it? Do you help guide them out of that, or do you have to wait for them to say, something's wrong, or they're having a physical manifestation of something? Like, how do you go about that?
Yeah, that's a good question. Like I said before, I'm never going to tell someone what to do with their life, right? So I've worked with people who want to stay in abusive relationships because that's what works for them, or they feel fear about leaving, or they feel like they don't have any other options, or it might be unsafe to leave. And so there are a lot of those variables. But when someone comes to me and they aren't really sure what to make of their situation, then what we'll do is really kind of break down, what are you experiencing? How does that feel for you? If it could be a different way, what would that be like? Would you want to stay? Would you want to leave? What if nothing was different when you left? Right? And we just really explore all the different avenues until they feel like they have enough information to make sense of what's going on and make informed decisions. Because oftentimes people will come in and they know something feels off, but they can't put their finger on why. And so it takes a little bit of unpacking to figure out what for them might be a trauma response, what might be something that is, getting stuck between two people. Each of their traumas might be getting provoked in a different way. And so if they're willing to explore that, I've seen couples that come in, they're on the verge of divorce. One or both of them have had multiple affairs. They've drained their bank accounts. They hate each other. They're fighting all the time. But they both recognize that they're deeply wounded, and that's where all of that is coming from. So they both get in, nose to the grindstone. They do the work. And 2-3 years later, they're having a really happy, fulfilled marriage and relationship. And then I've seen people come in and they're like, everything's great. My wife just thinks we need a tune-up, or my husband just is salty because I don't want him to have a man cave. And a couple of years later, they're divorced because they, finally were able to talk through all of the different resentments that they have, and they realize, we're just not a good fit. So it kind of is the whole spectrum.
And in those situations, I mean, do you have to try to identify specific things, like, is there some of this rage that you're talking about going on in there, or how do you pick it apart at that point?
Yeah, well, I mean, it depends on if I'm working with a couple or somebody individually, but definitely we talk about if rage is a part of the equation. And if somebody is experiencing physical violence or any kind of suicidality, we talk about a safety plan, and we develop something that can really make sure that they've got outlets and resources and support. But pending there's nothing super violent happening, what we're talking about is really the way people think about each other and the more covert ways that they exact their anger and resentment. And so that usually comes out in the form of weaponizing sex, weaponizing money, weaponizing power in other ways in the relationship. So affairs are a great example of eroticized rage, because they're usually born out of insecurity or feeling like there's a power imbalance. So I've worked with a lot of couples where one person has a bit of a default for shame, and so they tend to hear things like, hey, can you load the dishwasher this way, as you're a piece of shit and I hate you. And so they feel really unequal. Now that is not what their partner said, but that's how they hear it, right? And so they start feeling less than, and they use sex or an affair outside the relationship to feel more important and reestablish a sense of equality. This can happen a lot, if people are thinking about, I'm reading right now, somebody asked, can shame become sexualized?
That's my mom.
That's your mom?
Yeah, she's a psychologist.
Oh, yes, shame can absolutely become sexualized. So we think about like all of the different ways that people can use sexuality, whether it's in thought. So revenge porn is another thing that we were talking about before.
Yeah. So you can clarify exactly what that is then.
So revenge porn is an idea where somebody, without consent, shares someone's nude photos. So clinically, we call this
image. Oh, that's revenge porn?
Yeah.
Oh, okay.
Clinically, we call it image-based sexual abuse, because the person whose images are leaked usually has traumatic symptoms that mimic that of being raped or sexually assaulted. It's a really violent crime, even though there's not necessarily any bodily contact. So this is a big deal, and a lot of people don't really understand the implications of sharing someone's nudes, but it can absolutely wreck someone's nervous system, because we have such a private relationship to our sexuality, and we have a lot of shaming that happens societally, especially toward women for being okay in their sexuality. So when someone leaks their nudes, it's usually an act of revenge. They feel rejected, or they are trying to feel more empowered, and so they use that as a weapon to shame the woman or defile her in some way.
Yeah. Well, that made me think of, not that part, but the part where you're talking about just kind of body shame or image in general. There's a whole world of discussions I've seen, and with you as well, going on about body image, shaming, intimacy issues, difficulty coming to terms with sexuality, hiding from sexuality, and kind of being scared of it overall. So what's your expertise in this field, and what are like the main things that you've seen going on, especially recently, developing in discussions or in discussions with patients?
Yeah, absolutely. I just want to address someone's statement. They said not only for women does revenge porn happen, and that's absolutely right. Men are victims too, as are non-binary folks. So coming back to your question about like the relationship between sexuality and body image, is that what you're asking about?
Yeah, intimacy, sexuality, body image, shaming, all that.
Yeah, all that wrapped up into one quick soundbite. I mean, think about it this way. The relationship that we have to our body is the most intimate relationship that we're going to have, right? We live in our own skin every day. And if we experience shaming of our bodies, it can really eradicate someone's soul and create a really uncomfortable dynamic where they depend on outside validation to feel okay about themselves. So this can show up in a couple of different ways. We see a lot of kind of internalized shame starting to look like disordered eating. And kind of another way that people can externalize that is to become really sexual and get a lot of validation out of how many people desire them sexually. Mm-hmm. Now we see this financially too. We see people buy really expensive cars and use it specifically as a way to get attention and validation that they're good enough. Not that there's anything wrong with nice cars, but, but if someone can't find a way to value themselves internally, then they're often relying on these very, kind of external and socialized attributes to feel good about themselves. And so can result in a lot of distancing around sexual behavior. Mm. It can lead to a lot of sexual dysfunctions for men and women. I see a lot of men who struggle with early ejaculation issues or erectile dysfunction issues because they're really nervous about how their body is being seen or viewed. Likewise, I see a lot of women with low sexual arousal or difficulties maintaining an orgasm because they feel a lot of shame in their bodies and have a difficult time connecting to sexuality.
And is this a cultural phenomenon too amongst, various cultures who really make it almost illegal to be sexual in their community?
Well, I'll say this, that it's not unique to any specific group of people, culturally, religiously, gender-wise, racially, financially, all of those things. Shame is an equal opportunity sex killer. Mm-hmm. But certainly when people grow up with more repression around sexuality, they tend to develop a lot more shame around it. And then either they shut that part of themselves down in order to stay protected from the shame, or their sexuality starts to leak out sideways. And they start to do things that really go against their own value system to unconsciously sort of validate this experience of themselves being bad.
Mm-hmm. And how do you yourself find patients who are having issues with this? Is it like trouble with orgasm or just trouble with general relationship, in general, or what is it?
Yeah, I mean, it shows up in all different kinds of ways. I see it happening with extreme focuses on appearance. People will spend hours and hours and hours trying to augment their appearance, either with different cosmetic procedures or with the clothes that they wear or the exercise that they do. And not that any of those things are bad, but in excess, certainly demonstrative of a level of preoccupation that's taking them outside of themselves. We see it happen sexually in the sense that couples will shut down. They'll start experiencing differences in libido as reinforcing variables to suggest that they're bad, not good enough, not desired, things like that. And then where they once maybe were a little closer, they start to get further and further away. And the further and further away they get, the more difficult it can feel to come together because so much more vulnerability is required to repair as opposed to starting new. And so people then can start looking outside their relationships for validation. So that might look like emotional affairs or working really compulsively to get some achievement-based kudos, getting really distracted and organized in their lives, anything outside the relationship, where they might get really obsessive with their partner and require a lot more validation and feel like they're constantly a nuisance and not good enough. So it all kind of becomes a feedback loop of mm-hmm. shame.
And is this in any way related to body dysmorphia in general, or just general body image, where they have sexual issues the same way that they would have issues with patients that come see me saying, well, my ears look off, and mm-hmm. Is it something where nobody else would see that problem, only they see it?
Sometimes, right? Sometimes, sometimes people have shame around things that other people see, and they may or may not have the same judgments about them, but they certainly are observational aspects of someone. But oftentimes what I see is that it's not really related to any kind of physical abnormality or how do I want to say this? Anything related necessarily to any physical reality in their bodies, and more so the meaning that they've made to it. And I see this a lot with people who grew up in households where their bodies were critiqued, either favorably or unfavorably, a lot. They start to, again, assign value to who they are as a person based on how much praise they get for looking a certain way or not looking a certain way. When people are really shamed, especially men experience this, I think, with less frequency than women, but women definitely experience a lot of shaming around their appearances, especially if it's attracted sexual attention that people in their immediate circles have determined to be inappropriate. And so young women who aren't even trying to be sexualized find themselves sexualized because, unfortunately, that is the culture we live in. And if people's parents hold them responsible for that, they can have a very complicated relationship with their sexuality later that prevents them from being able to enjoy sex, initiate it, or conversely, they go the other direction and kind of seek it out compulsively to maintain a tether to that validation.
Yeah. And, one thing I see a lot of questions for right now, which, I thought we could address is, and I'd like I'd like it to come from you more than other people, because I've seen a lot of discussions about pornography in general. And when I see it, I see a lot of extremism, like in terms of the people saying it is by nature an addiction. It's by nature, it's this. And I don't think it is. I see it as a range, kind of like what you're describing. Most things, there's a range to things. It's not by virtue or by nature something evil or terrible.
Right.
It is something that if you do it in extremes, it's very bad, and if you do it in really, I guess, like harmful ways, it's really bad.
Yeah.
But I mean, do you agree? It's as far as you're seeing clinically from people, most people who would even watch pornography, you'd consider normal, and there are ones that you. Where do you draw the line and say it becomes a problem?
Well, just in how we were talking about sex addiction before, or any kind of addiction, it's not a problem until it's a problem. And so it's really key to think about, how does porn influence someone's perspective on sexuality, on themselves? Are they using it to escape and not having other kinds of sexual experiences that counter the experience of being in the fantasy of porn? So do I think porn is bad inherently? No. That would be like saying alcohol is bad inherently, and it's not. But people's relationship to it can be very problematic. And so, I think the question to really ask is it changing the way you see the people with whom you'd like to be sexual? Because some of the negative consequences of watching too much porn, or porn exclusively and not having real life interactions, is that it can create a very transactional experience between two people when they are in fact sexual. Because mainstream porn, there are some really great ethical porn producers that do a nice job of showing the reality of the sexual experience and demonstrating pleasure for all partners involved. But typically mainstream porn is very focused on men's pleasure, and women's pleasure tends to be really in support of the men being in pleasure. So they don't do a good job of demonstrating the realistic arousal arcs that happen for men and women. And what happens, and I'm seeing this with a lot of young adults right now, they grew up watching porn and it was their primary source of sex education.
Yeah.
So when they're with a person in real life, they don't understand that people's bodies need more time to warm up. So they are going right for sort of the coup de grace moment and getting frustrated when that doesn't happen, both partners. And they tend to internalize that as, I'm doing something wrong, I'm not good enough. And so there's that aspect that I think can create a lot of dangerous effects for people who watch porn.
Yeah, I fully agree with that. And I see it as, just like you're watching a movie. I mean,
Yeah.
movies are made of fantasy. It's not, these are not all documentaries and like reality films. So they're made of, and you shouldn't look at it as reality. And what happens in general is, I think the manufacturers of this, they could be very artistic, which does, happen in that world, or they could just be trying to sell to who they think their main buyer is. And so they're trying to give kind of the quick excitement to, they're assuming that only guys are watching. And so they do all that. But it does lead to problems when people rely on it, for sure. And I've seen that actually with conversations I've had with people as well, that they do think that this is how it's supposed to be. I'm doing it like the pros. These are the professionals. That's how I'm doing it. And it leads to big problems with their own, relationships and how they can climax and things like that.
Yeah.
So,
I'm seeing a pinned question. It says, is it normal for your boyfriend to watch a lot of porn if you live together? Yeah. Well, I think normal is a dangerous word.
Yeah.
Right. But what I would say is that if it is something that makes you uncomfortable, it's worth having a conversation about. And if someone chooses to prioritize porn over the relationship, and that's a problem in the relationship, then perhaps that's one of those things that now it's become a problem in your life. Not to say that watching porn is inherently bad, but it's causing a ripple effect that might warrant examination.
Yeah, so that's where it is causing a problem. That's where, I agree. You do need to have a discussion about it. And if it continues to have a negative role, then you got to go talk to Kate about it. So that's, but that's where you do need some kind of intervention. You shouldn't sit there uncomfortable with somebody watching porn all day while you live with them instead of hanging out with you. It could make you feel not great about yourself. I wouldn't like that personally. No. I'm not sure who would.
Yeah. And if it gets in the way of them like helping around the house and holding their part of like the domestic situation, that can cause a lot of resentment. And back to eroticized rage, I've seen this a lot in couples where one partner will say, oh, we got into a fight, and then my partner went in the other room and watched porn. Right. And so sex has become kind of fused with that anger and used as a salve, and also leaves the other partner feeling sort of like they're being cheated on in the next room.
Is that sort of saying like, I don't need you, or is
that's that revenge?
Spite porn.
Yeah.
We've been watching Curb Your Enthusiasm, opening spite coffee shops and things like that. So to switch gears towards toxic relationships and cluster B, narcissism, this and that, I didn't think about it this way. What do you do in relationships where there's a child who starts to recognize that their parents are in a toxic relationship, or that one of them has narcissistic behavior? I mean, that's a very huge possibility, right? It's very common, I'm sure.
Yeah, I mean, how old is the child? Are we talking about a young child or an adult child?
If they follow me, we're assuming they're in their like 20s.
Okay. Yeah, I mean, this can be a really bitter pill to swallow, to recognize all of a sudden that your parents are fallible, first of all, and then really to kind of, have an awareness that there's a lot of toxicity or dysfunction between the two of them, or one or both of them might have some personality disorder traits. And I think it's a complex conversation, and probably one best had with a therapist or with a support group of some kind, or a trusted friend. I really like the 12-step group adult children of alcoholics, because it's not just limited to adult children of alcoholics. They've expanded their framework and include dysfunctional family systems. So you can get a lot of really great support and learn how to set different boundaries and really kind of grieve the relationship that you haven't had with your partner, or with your parent, I mean, and may never have if they're not willing to get help. And that can cause a lot of grief for people, because we all want to stay connected to our parents.
Yeah.
There's an imperative there. And so if it comes to a place where the only way to protect yourself is to go no contact, it really requires a lot of processing around that, because it's challenging to choose between yourself and your own well-being and a family system in which you feel uncomfortable.
Right. And for
kids or anybody who feels that this issue is present and can't afford to go see somebody, are these group sessions or online forums available for them?
Yeah. ACA and any 12-step fellowship program is free. So that would be a great place to start if you don't have any resources. There are a bunch of great books around healing from relationships with parents who are toxic. I really like the books Growing Yourself Back Up. That's a really good one. Mm-hmm. And then the other one is something, I'm forgetting the name of it exactly, but how to heal from emotional parents or immature parenting, something like that.
Oh, okay, that sounds like a good one.
Yeah,
I've got very mature parents. They're they're watching, so they're very mature.
Very mature.
So, what about resources for people who are going through shame?
Oh yeah, The Shame Factor is really good by Stephen Poulter, Dr. Stephen Poulter. I really, really love Facing Codependence by Pia Mellody. That's an amazing book that really talks about all of these kind of developmental regressions in such a human way, because all of us regress from time to time, and there's no perfectly healthy, normal person, because that's a really subjective term. But whenever we're in our best functional adult selves, we still have the potential to hit a bump in the road and regress and do something that doesn't really demonstrate our best selves. So I think, she talks about these topics in a way that's really careful not to vilify people and really honors that everyone is imperfect in their process of healing from inevitable bumps along the road of development.
Yeah. And going back to this, so we've had 3 people ask this in different ways, which mm-hmm. And the questions I got were actually that they are watching the porn with their boyfriends, mm-hmm. and they feel bad about themselves compared to the bodies that they see over there. Mm. Is that normal that they feel bad, or is it unrealistic, or what do they do? I mean, coming from a guy watching porn, the guys aren't the same as the guys on the porn either. So I'm sure they have body image issues as well. But what do you think?
Yeah, I think everybody who watches porn is subject to comparing themselves to what they see on screen. And that's where porn can be kind of dangerous. So if someone doesn't feel okay about how they are in their own skin, or they feel like their partner is using porn as a conduit to become attracted to them sexually because they're not necessarily attracted, then that can cause a lot of shame and a lot of problems with intimacy between the two of them. So if that's happening with people, I would recommend that you talk to each other about it and find a way to express your concerns and talk about those vulnerabilities. And if it's something that's really getting in the way of you being sexual, you might consider asking to not do it, right? So that you can really stay connected and feel positive about yourself.
Yeah. I think these are all very hard things for people, who are uncomfortable communicating to bring up. But if you need help on how to broach it, you could just talk to Kate about it.
I just saw somebody who said they wanted to have a labiaplasty because of porn. And here's what I'm going to say to that. If you want a labiaplasty because you want to change the shape of your vulva because it's meaningful to you, go forth and do it. Don't do it because you think there's something wrong with you. And every vulva is different, and there's wild variability. And unfortunately, what's shown in porn is really not reflective very often of what's happening in the real world. So I would recommend you go check out this Instagram page called Pussy Pots. There's it's a woman in the UK who has created all of these ceramic bowls. They're beautiful. She hand throws them. And at the inside of every bowl is a vulva that she has sculpted into clay. They're gorgeous. There's so much diversity. I have a video on my YouTube channel, Modern Intimacy, that showcases her work. But I mean, really, don't think that your vulva is wrong because it is not what you see in porn.
Yeah. I mean, and again, I hate to compare to other movies, but you can't watch Jurassic Park and want to be a dinosaur. You can't watch, you can't watch like Rocky and want to be Rocky. This is a field that's there to sell to people, to excite people. It has nothing to do with the reality of the majority of people.
Yeah.
you can go listen to beautiful singers. Not all of us can sing like that.
Right. But you might also check out porn that includes more diverse bodies and inclusive body types. Erica Lust does a really great job creating porn that is so much more inclusive, erotic, sensual, and body positive. And it can be a really nice shift from, porn that feels like you can't be a part of it because you're not seeing what you see on screen.
Yeah. And the last question for you, advice on cheaters in relationships. Is that for the cheater or for the one being cheated on? Advice for the cheaters, don't cheat.
Yeah, that's a big question. I don't know.
I break up with somebody before I cheat on them.
It's very noble of you.
It's easier. That's like, it's easier, and I've got no interest in deceiving somebody. It's it's too much work, and it doesn't help me. It's there are, I think if you have kind of a very simple, easygoing life, cheating makes things very complex and difficult, and it's actually more of a selfish thing just to break up with somebody and tell them the truth. It serves you better.
Well, it serves everybody better, but a lot of the gasoline that fuels infidelity, remember, is about those unconscious motives of proving that I'm good enough or I can get away with something. That's a big one. And so I think, if there's a lot of infidelity in a relationship, you might ask yourself, okay, is this a one-time thing? Is it something that's habitual? Has it happened in other relationships? How motivated is someone willing to actually address this issue? Will they go to therapy? Will they read the books? Will they do all the things? But if you find yourself really struggling to trust them, it might be really important to ask yourself why you are compelled to stay with that person. Aren't there other options?
Yeah. So we'll finish up now. The thing that I would ask from you is, you'd listed a lot of good resources, books, websites, Instagram pages. If you could send those to me, I will post them as part of this podcast, which is going to go later on YouTube and on the Reality Pill page. So at the Reality Pill on Instagram. We're still setting everything up, but it's all going to go on there. So if Kate, you don't mind sending it to me. If you guys have any questions for Kate later, Dr. Balestrieri, you can always contact her. She has a couple different sites, I think, now that you're organizing, but the main one is just her name that's attached over here, which is it's at Kate Balestrieri.
Dr. Kate Balestrieri. You can also just go to modernintimacy.com. My new website is going to be jam-packed with all different kinds of free resources, content about sex, relationships, mental health. And it's not finished yet, but good things come to those who wait. So throw your email address in there and I'll let you know when it's ready to go.
Yeah, and don't forget Pussy Pots.
Don't forget Pussy Pots.
It's the best name. All right. Well, thank you so much. And anybody who needs her, please contact her. She's got a wealth of information beyond what we got to talk about today. So
thanks for having me on.